And we're back. It's another Thursday at lunchtime. I hope you guys are doing great. We have a guest with us today. So you don't have to just listen to me and Dr. Dan. We actually have somebody else here to talk with us. We have Jessica Drummond. She is the author of a book called Outsmart Endometriosis, which I am so excited to have her here so that we can talk about this. So welcome with us today, Jessica.
Hi, thanks so much for having me.
How are you today, Jessica? Doing well?
I'm doing well, yes.
So for all of our listeners, we get a break now, right? So you're tired of hearing Dr. Dan and Dr. Betsy. We have somebody else now coming on in, so it's all good.
You know, before we get started, I mean, people who have endometriosis kind of know what this is, but can you tell for the people who don't know, what is this condition and why isn't it an issue?
Yeah, so endometriosis is a disease process that the origin is a little bit unknown. There are three likely factors. There's some underlying genetic familial components. Endometriosis at the same rate as it is in the adult population, which is 1 in 10 women of childbearing years, presents in fetuses. When they've done, it's actually 1 in 9 fetuses. So we know that endometriosis is, tends to run in families, but it's also an inflammatory condition, and there are likely some autoimmune components, although that's somewhat debated. And then what it is kind of like a non-cancerous cancer. So it's little lesions of tissue that's similar to, but not exactly the same as, the inside lining of the uterus, which is called the endometrium, which is why it's called endometriosis. And these lesions can be found all over the bowel, anywhere outside the uterus, on the ovaries, fallopian tubes, ligaments and other tissues in the pelvic and abdominal cavity. It's been found on the diaphragm, the knee, the nose. So it's a systemic condition that has lesions throughout the body, sometimes just, a few lesions, sometimes more extensive lesions. And one of the challenging things about endometriosis is that you can have very extensive disease and very little symptoms. You can have not very extensive disease and quite a bit of pain and fatigue and anxiety and other mood symptoms and insomnia and all of that, energy issues. So the extent of the disease does not indicate the symptoms necessarily.
It's pretty interesting. This could be a pretty devastating condition for people where, it causes severe pain or even infertility, which can be very stressful for couples that are trying to get pregnant, because this stuff starts growing on the tubes and occludes the tubes, and you can't get pregnant, or you have a higher risk of ectopic pregnancies, or pregnancies get stuck in the tubes, and that can be life-threatening. So, and we don't have a lot of, in traditional medicine, we don't have a lot of options for treating these patients. It's kind of been, this enigma, like what to do. But, I think, which is great. There's so many more holistic things that people can do for themselves to help manage this. And I'm so excited for you, because that's what you have, a book called Outsmart Endometriosis. What got you to write this book?
Well, my background is actually in pelvic health, especially physical therapy. And so for 20 something years, I've worked with women with pelvic pain. And some of our most challenging patients are women with more chronic long-term pelvic pain, especially with endometriosis, because, especially 15, 20, even 10 years ago, there were very few treatments. So a lot of at that time, a lot of first line treatment was things like opioids or, nerve stimulators, which are very aggressive and not necessarily very helpful, and also addictive and problematic. So what happened, around 10 years ago for me is that I had a personal hormonal health issue that wasn't endometriosis, had to do with being postpartum. It was a little longer than that, actually. Now it was almost, my daughter I was postpartum with my first daughter, who's 17 now. So it was like a while ago. And I learned that there was so much I could do nutritionally and with mindfulness and vagus nerve toning and stress management to change my hormonal health. And I thought, maybe this could be helpful for my patients with that very difficult pelvic pain. And so I went back to school. I got a doctorate in clinical nutrition, and I started to bring all of these tools together. Pelvic physical therapy is still very valuable for pain management and pain relief. And fortunately, in the last decade, the surgeries have evolved to be much, much better. We now have skilled surgeons who do endometriosis excision surgery all day, every day. It's like exclusive to their practice. So what our clinic does is pre-op. Not every single client that we work with has surgery. Some of them have had surgery in the past. Some don't need surgery, but many do end up having one, possibly two excision surgeries, but it's not like the 16 surgeries that I used to see, 15 years ago. And we do a whole program of nutrition, stress management. We have everyone tracking their heart rate variability on fitness trackers, and we really work on calming the nervous system, improving nutrition and nutrient intake and absorption, digestive optimization, because a lot of these patients have bloating and endobelly and things that are actually really SIBO or dysbiosis. So we get kind of the body ready for surgery and then improved after. And following up to that, dealing with all three of these systems: nervous system, digestive system, immune system, also helps with fertility as well.
What are some? I'm sorry. Go ahead, Dr. Betsy.
Dr. Dan, go ahead.
So when you talk about a nutritional approach, what would be a typical nutritional approach for somebody who has endometriosis?
So the most important thing is optimizing digestive function. So the first layer is calming the nervous system, improving heart rate variability, because no matter what someone eats, if you're eating in fight or flight, you can't be in rest and digest, right? So we have to retrain, right? We have to retrain how people are eating. Yeah.
Right.
So how we eat is as important as what we eat. So we start there. And then there's a range of anti-inflammatory food plans that vary a little bit based on genetics and how active people are and things like that. But the foundation of all of them is a lot of vegetables. So aiming for, in the neighborhood of 8 or more servings of vegetables daily. Initially, if there's a lot of bloating or a lot of, bowel movement issues, we will start with cooked vegetables, soups, blended things, protein. Many of these women are very deficient in amino acids, so that affects the neurotransmitters. So we work on protein absorption. So not just chewing and calm eating, but supporting with things like digestive enzymes or betaine HCl, helping with visceral physical therapy to help with gut motility.
Right.
So, vegetables, protein, beneficial fats, olive oil is great, avocado, sometimes coconut oil. And then it varies, person to person in terms of what kind of protein. Some thrive more on more vegetarian sources of protein. Others thrive more on fish and chicken and meat. That's a little bit personally dependent, but those three things are really the backbone. And the other thing that we use a lot, because there are some decent studies on adding therapeutic doses of things like curcumin or fish oil. Right. So, or oregano is another good one. So instead of just using supplemental therapeutic high doses of these antimicrobial and anti-inflammatory nutrients, we layer them in with the cooking as well. So, sprinkling a little bit of oregano on in your tomato sauce or, that kind of thing. And the other thing that will guide the food plan is bladder pain, because some people with bladder pain related to endometriosis are going to be more sensitive to things like tomatoes and citrus. And some of the things that until we restore the lining of the bladder, we have to kind of keep the diet a little bit more bland, not forever, but for at least a few months.
And that's a good point, because I often see that in patients where endometriosis and interstitial cystitis go hand in hand.
Yeah.
And so interstitial cystitis, for people who don't know, it's an inflammatory condition of the bladder. And it's interesting because I personally don't think that that's its own condition. I think it's an inflammatory condition that's been triggered by something else. That's why a lot of times with interstitial cystitis, you get so much of like variation in history of patients. And that's why like the treatments for all those patients are just not the same. So,
yeah. And, you know, endometriosis very commonly can grow on and around the bladder. So often the surgeons will say to me, you know, this particular patient had a really inflamed bladder when we went in there. We could see how red it was. So let's be mindful. And for some of those patients, lowering oxalates in the diet can help. Histamine issues are common in endometriosis and in painful bladder syndrome. And the other thing that overlaps very often, we call this the terrible triplets: endometriosis, painful bladder syndrome, and vulvodynia. So, which has more of an autoimmune component. So when those three are presenting, we're really looking to optimize all of those physiologic systems over time.
And it's funny because somebody asked me the other day, you know, with my specialty being pelvic health, they're like, you don't talk a lot about pelvic health. You're always talking about gut health. And because, you know, I think I had to make it clear, because people keep asking me, why are you a gut health specialist or are you a pelvic health specialist? I'm like, you cannot separate the two, because every medical condition that's out there really has some kind of effect or origin in the gut. And so we have to talk about gut health before we're going to get anything else better. So
for sure. Yeah. In fact, you know, I used to do in my practice a lot more hormone testing, but with endometriosis, there was an interesting study a couple of studies actually, that came out in early 2018 that showed that we used to think the lesions were mostly kind of estrogen fed, right? So women would be on estrogen suppression therapy or hormonal birth control. But we've now seen from histological studies that those lesions can be upregulated in estrogen receptors, but they could also be upregulated in progesterone receptors, or both, or neither. And so, and depending on the woman, they could have all of these four, you know, presentations at the same time. So we can't really dial up, dial down, you know, with any specificity, the hormone protocols to hope to just shut down the lesions. Plus the lesions make their own hormones, especially estrogen. So there's not an easy way to just kind of shut off the faucet of hormones. And the other thing that I've learned over time is, even with almost all of my patients, not just people with endometriosis, you know, really optimizing digestion, nervous system, and immune health, I don't even have to test the hormones because they just improve on their own.
Yeah, I agree.
Yeah. So go ahead. I'm sorry, Dr. Betsy.
Dr. Dan again. Go ahead.
Go ahead. No, you go. Go for it.
Well, I was going to ask you, so with your book, is this something that people are using to kind of like optimize their health, like pre-surgery, or to an avoidance of surgery? Like, how does your book fit into their care?
Yeah, so it is a fairly step-by-step kind of program. You know, obviously we can't personalize it to everyone, but we talk about how we do that. Either pre-op or, you know, some people. So if fertility is a strong goal for you, then I always recommend at least having a consult with a skilled excision surgeon, because even if we can completely improve or resolve your symptoms using this nutritional approach, it can still benefit your fertility in some cases to still have the surgery. So it's worth having a consult at least. But there are some women who either already had their children, because, you know, endo is not it doesn't stop at menopause. It doesn't stop after you have, getting pregnant doesn't cure endometriosis. So there are women out there who've either already had their children or fertility is not a strong goal for them, who just want to have symptom resolution. In that case, yes, they can very much, follow this plan, either pre-op or in general, to reduce or eliminate symptoms, or even to recover post-op if they've already had recent surgery but haven't had the opportunity to have good nutritional support at any point along their journey. So it works at any time.
That's great. That's such a wonderful resource. Yeah. And so you came out with the book last year, but it's now coming out paperback, which is really exciting.
Yeah. So one of the things I'm so excited about this pre-launch right now is February 2nd, the book comes out in actual physical bookstores, which I know fewer people are going to than they used to, but places like Target, which we still have to go to and get our toilet paper and things like that. So, my hope is that the physical book being in shelves and, in regular stores, not just Amazon, where we all live right now too, will, bring it, someone might just run into it when they're going to buy their toilet paper. So the more we can support the book and pre-order now, the more people can find it when they're just doing their grocery shopping or walking through a neighborhood bookstore.
That's great. And there's so many people with this condition, or even don't even, have pelvic pain issues or have fertility issues and don't even realize that this is something that can be going on. So it's just great even to just get out the word that this is a condition and that people do have it, and there are ways to control it and manage it, and even, surgery to take care of it.
Yeah.
So,
What are some of the physical therapy approaches for endometriosis?
Yeah, so the physical therapy approaches primarily deal with the pelvic and sexual pain that comes with endometriosis. So oftentimes there's pelvic floor tension. So in the whole pelvis is like a bowl. The bottom of it are muscles that support the internal organs of the pelvis, the bladder, the rectum, and the uterus. And that whole kind of hammock of muscles can be very tight. And I describe it in this way. Let's imagine you had like a big cut on your shoulder, like you walked under a tree branch and it cut you, right? You might eventually have headaches, not because of this particular cut, or if we think about the endometriosis lesion growing on your bowel or something, but because you've kind of walked around like this, like guarding it. And so those muscles being tense all the time for, weeks and months and years of people's lives, a lot of times this starts to present as early as pre-puberty with digestive issues and things like that, age 8, 9, 10, 11. And if you've had digestive pain and period pain and pain between your cycles and pain with sex for years, the average is 6 to 12 years still for diagnosis, you're going to have a lot of myofascial kind of guarding tension that is really important to unwind. So physical therapy helps a lot with that. And we do, intravaginal, intrarectal physical therapy. The other thing that's really beneficial is so many women with endometriosis either have SIBO before, which is small intestine bacterial overgrowth before their surgery, because there's endo lesions, adhesions growing on the small intestine or the large intestine. Sometimes parts of the intestine even have to be removed during surgery. So the valve between the small and large intestine can be removed. So there's sort of a chronic gut dysbiosis issue that we deal with. So physical therapy can really help with abdominal visceral work. It's like a gentle abdominal kind of massaging work that keeps that digestive tract motility moving. So we help that with some supplements and some nutritional recommendations, but the manual physical therapy, visceral physical therapy in particular, is really helpful for that. And the fascia in general, because if you've had constipation or ovarian cysts, some people have PCOS and endometriosis or constipation, all of those organs are very close together in a pelvis. It's, only about this big. So if you can kind of gently move the fascia and organ around those organs, it gives more space and less discomfort. And we can also do education on things like better sexual positions or how to relax the muscles before intercourse.
Right. PCOS and endometriosis at the same time. I don't think I would want that. That's for sure. That's a double whammy at that point, right?
For sure. But, you know, it definitely happens, you know, blood sugar instability or people with excessive testosterone or estrogen dominance, you know, and the good news is, though, a lot of the approach to kind of, if we take that system by system approach, we can fortunately deal with both of those at the same time.
Right. That's why I brought up the PCOS like that, because of that insulin resistance and so forth. It's just going to make the situation much worse.
Yeah, because of the inflammation.
That's right.
Yeah.
And it's interesting because as a gynecologist, I have seen this go up, like the rates of people with these conditions like endometriosis and PCOS have just gone up over the last couple of years. And sometimes I go, well, is it really going up, or is it just I'm seeing it more? But, you know, looking at the statistics, it looks like it's really going up. So, you know, then the question is, like, we know that in general we have bad diets. So is it all our bad diets? Is it also like some of these environmental factors that are coming into, like the endocrine disruptors that are in our environment? So
yeah, I mean, I think it's absolutely all of those things. You know, we need more liver support. You know, people certainly, I think very few people are overeating leafy greens. Like, that's just not happening, right?
Right.
And so on the one hand, our livers are not, you know, optimally functioning. So many people are constipated. I mean, it's so common.
Right.
In fact, it's the number one cause of childhood incontinence, bedwetting, things like that. The number one cause is constipation. So, you know, if you have an 8-year-old who has a family history of endometriosis, under a lot of stress, doesn't have a great diet, has chronic constipation, bedwetting, like this can start very young. And then you layer on what Dr. Dan was just talking about in terms of chronic insulin resistance, which again, we know type 2 diabetes is starting much earlier. This really, you know, that contribution to inflammation is starting earlier and earlier. So, you know, the good news is there are some organizations like the nonprofit organization Endo What. They produced a movie called Endo What. They are now doing school nurse education kits for endometriosis, because we really do need to start looking for this in middle school, you know, early.
Really, that young? Wow,
yeah.
that's young.
Yeah.
You know, I was thinking back when you were talking about constipation. So that's like a cycle in itself, because if you have a poor diet and then you have this gut dysbiosis, your gut is thrown off, and now you're getting constipation because of that. And now because of the constipation, you're not processing your hormones, because there is some areas of estrogen metabolism that are happening with the stool, and you're getting potentially reabsorption of that estrogen from the constipation because it's sitting. So then you got this, just, it's going to explode. You have this system that's just primed for these conditions like endometriosis.
Where does obesity fit into this, or at all? Because I've read some where actually endometriosis, you may have a lower body weight instead of a higher body weight. And I find that intuitively different, right?
Yeah, I would say clinically, I do see that. I don't know the data right off the top of my head, but I actually tend to see more women who are underweight or just we have a lot of women with eating disorder, because exactly what we were just talking about. This starts in it starts making itself known in pre-puberty or puberty. So we were talking about, you know, 8 to 13-year-old girls, when it's a huge time for body awareness anyway. You know, most 8-year-olds have already started disliking their bodies. And then endometriosis, because of the small intestine bacterial overgrowth, often presents with what we call endobelly. It's like a chronic bloating. So if you're dealing with chronic bloating, but you think you're overweight, and then you start kind of falling down the rabbit hole of eating disorder, we definitely have a stronger problem with eating disorder and keeping weight on our clients in general. We work with a lot of women who are in early college years, which makes it really challenging too. They've got a lot going on in your life. And of course, all your friends want to do is eat beer and pizza, right? So
wait a second. When you get later in life too, you want to have a little beer and pizza.
Right,
So,
right. So it's a very challenging thing, and certainly women with endometriosis can be more overweight, more underweight. It's not necessarily directly related to the disease. I think it's actually more of a consequence of the disease, because it's a lot of women are uncomfortable eating, or they start down a rabbit hole of eating disorder.
it seems that these endocrine disruptors are really causing a lot of issues, right? What are some of these endocrine disruptors? Because I'm sure the audience is like, they hear these words. We know what they mean, but they're like, what is that endo? I heard that somewhere along the line.
Yeah. I mean, one of the most common things is just simply drinking water out of plastic bottles, right? So anytime you have food or water in plastic, even I had one patient, she lived in a really hot environment in the Middle East, and she would wear plastic flip-flops all the time. And we took those away. Her pelvic pain was gone. So, plastic exposure is big. There's a lot of endocrine disrupting chemicals, which mess up our hormones in skincare and shampoos and things like that, household cleaning products. So those are the kinds of things we want to look for. The environmental working group has some good information about, how we can lower the exposure to that. But plastic bottles and plastic flip-flops are two that I see all the time in my practice.
It's amazing because drinking out of, water out of a plastic bottle has become so commonplace for so many tens of millions, hundreds of millions of people all over the place. And I'm always yelling at my son when he's drinking out of the plastic water bottle. I'm like, here's the tin, here's this, here's that. So,
I know.
it's interesting.
All the time. I'm always like trying to get them to drink more water. And I'm like, but don't go for the plastic bottles, because you don't know how they were stored. If they were stored in a hot warehouse, they're leaching chemicals into the water from that plastic. So yeah, it definitely get something other than plastic, go glass, if you can, or, we have those canteens, so different things. So Jessica, thank you so much for being with us today. I always love talking to you, and I'm so excited about your book. So people, I want to also just tell you, I looked at the statistics, 16% is the general prevalence of endometriosis in the general population in the United States, and that's considered underreported. That's 16% of women in the general population that we know of have endometriosis, but that number can be much higher. So this is really a condition that can affect not only you, but a loved one. So this is something that you need to look into. So,
and where can I purchase your book again, Dr. Jessica?
The link is right here, kind of running down the screen, but right now you can find it. Just, search Outsmart Endometriosis at barnesandnoble.com or target.com and find it there, or amazon.com. And it's very common. And so, if anyone is struggling with any kind of pelvic pain or period pain or digestive issues, it's a good thing to consider.
Yes,
thanks so much
definitely.
for having me, guys. Thank you.
Great. Thanks so much, Jessica.
Great having you on. Take care now.
All right.
Thank
Talk
you.
to everybody again next week.